Every day that we're alive, we have small pains and discomforts. That's normal. But just because we have a progressive, serious illness, it doesn't mean that pain needs to progress as well. Most physicians, whether they be specialists or family physicians, should be able to take care of pain. If they're having difficulty, they should be referring to a palliative care team. Palliative care teams are made up of interdisciplinary groups of people, whether they be physiotherapists, social workers, psychologists. All of these people together can take care, along with the palliative care physician, of pain. We have to realize that pain is not just about the physical discomfort, but it can also be related to other kinds of suffering, such as emotional suffering, spiritual suffering. So it makes sense for a whole team to be there to try to take care of that person's entire being so that the suffering can be made tolerable. We have all kinds of different molecules now, medications that can take care of pain, not just in the morphine family, but also in the anti-seizure family. And when used properly, small doses, increased gradually, we're able to take care of that patient's suffering, that patient's pain, without there actually being all kinds of side effects. We can minimize side effects so that that person can actually have comfortable days where they can actually be fully alive, alert, in contact with their loved ones, their friends, and so that those days that they still have ahead of them can be fully lived. That is what quality of life is about, and that's what palliative care is about, making sure we're giving the utmost quality of life to those people. Most pains are quite easily controlled. There are just a few people, a few patients where unfortunately the pain is harder to control. And this might be despite being seen by chronic pain specialists, by anesthesiologists, etc. Sometimes palliative care does refer to these other physicians. For those people where we are not able to control their pain, and like I said, they are rare, we have in palliative care other means of relieving suffering. And one of those means is palliative sedation. We can make that person sleep so that they're not suffering with their pain or any other kind of suffering they may have. We will continue as palliative care specialists to take care of all their symptoms as they're sleeping. But that person will not be in contact with their pain. This is of great relief for that patient, but also for that family of that patient, which is also suffering when they see their loved one in pain. So that end of life, for those few rare people who need palliative sedation, that end of life can be peaceful, surrounded by their loved ones, serene, so that they can have a very peaceful end. Does pain have to be part of the end of life? Absolutely not. It should be well controlled throughout the course of the illness, all the way until that last breath.